Hi, I would like to talk to you about overactive bladder. Hello, my name is Dr. Alexandra Dubinskaya. I'm a urogynecologist and the founder of Los Angeles Institute for Pelvic and Sexual Health. Have you ever found yourself wetting your pants? It's very uncomfortable, inconvenient, and I'm sure causing a lot of stress in your life. But did you know that there are different types of urinary incontinence? So today I would like to focus on overactive bladder. This is a condition when the bladder muscles contracting without your will. So when the contraction happens too frequently, we experience it as an urge to go to use the bathroom. And at some point, those contractions can get so strong that your pelvic floor muscles can't hold it anymore and you pee your pants on the way to the bathroom. So what can be done? First of all, you need to watch what you're drinking. A lot of drinks like coffee, alcohol, sparkling water can irritate the bladder and actually cause the bladder muscle to contract more frequently. Also, watch out how much you drink. The more you drink, the more you pee. So if you find yourself waking up in the middle of the night and using the bathroom and you do it more than once, try to avoid drinking any fluid 3 to 4 hours before going to bed. Keep in mind, it's important to go to the bathroom on a regular intervals. So try to go and use the restroom every 2 hours. If you want it or not, it will help you to stay on the schedule and will prevent accidental leaks. Doing pelvic floor physical therapy can be very helpful. So let's say you already adjust what you drink and how much you drink. You try pelvic floor physical therapy. What's next? Is there anything else out there that can be done to help you enjoy life without bladder leaks? There is a modality called peripheral tubular nerve stimulation. It's basically acupuncture. You come to the office, we insert the needle, very small needle, next to your ankle in the area where the peripheral branches of the nerves that innervate the bladder pass through. So we insert that needle, we attach the current, and we basically retrain your bladder nerves. The procedure is not painful. You obviously feel that the small needle is being inserted, similar to acupuncture needle, but procedure is very well tolerated. Procedure performed once a week for half an hour. The usual treatment protocol is 12 treatments, and then we try to space out those treatments with the goal to get to 1 treatment per month. This type of treatment is not for everyone. It's very time consuming, but it's very minimally invasive. Another option is to try the medications. And there are 2 main types of medications, anticholinergic and a beta-3 agonist. They work similarly on the bladder. They basically relax bladder muscles and let bladder hold more urine. The only difference between those 2 classes is the side effect profile. For example, anticholinergic medications are known to cause dry eye, dry mouth, and constipation. There is also some emerging data about risk of dementia when you take the anticholinergic medication for a prolonged period of time. Beta-3 agonists do not have that side effect profile. However, they're not really well covered by insurances. Some women prefer to have a local treatment. And one of the best local treatments is injection of Botox in the bladder. It does the same to the bladder as to the wrinkles on your face. It relaxes the bladder muscles and allowing the bladder to hold more urine. How we do the Botox procedure is we insert a very small tube through your urethra, and on the end of the tube there is a small camera so we can see inside of the bladder. We fill your bladder with saline so we can see better, and we inject the Botox into your bladder muscles. This procedure is performed in the office under local anesthesia. It takes about 2 minutes to perform and very well tolerated by patients. There is a small risk, about 1 to 2%, of urinary retention, meaning that some women might have difficulty peeing afterwards. But the good thing, that effect is temporary. When you can't pee, you just insert a small catheter to empty your bladder, and then as the effect of Botox wearing off, your retention also resolves. If you develop that side effect, it doesn't mean that Botox is not for you. It just means that with the next injection, we need to adjust the dose of medication. What other options to treat overactive bladder? Well, there is actually a neuromodulation, retraining of your bladder nerve. Similar to the heart pacemaker, we insert small wires that follows the pathways of the bladder nerves and basically retrains those nerves. Usually we do a trial in an office where we insert the temporary wire, and if after the week of having the temporary device you notice significant improvement, we go to operating room and place the permanent wires and a battery, and that device usually lasts 5 to 12 years. So as you can see, there are a variety of treatment options for overactive bladder. Which one is right for you? Well, it depends on your lifestyle and preferences and other medical conditions. The best way to address your overactive bladder is to actually see a urogynecologist who can help you figure out what is the best treatment for you.